Welcome to part two. Today we're talking about the opioid pandemic, how it affected pain, and how it still affects us today. People have been trying to get rid of pain since the dawn of time. But in the 1990s, professionals started using opioids. Now, of course, there was a concern about addiction, overdose, things like that. But in the late 1900s, early 2000s, it was found to be non-addictive and safe to prescribe. So physicians all over the world, when somebody had pain, would prescribe opioids. They even made promotional videos for things like Oxycontin, saying that if you took this drug that was prescribed to you, you could get back to doing all the things you want to do. And with their research that they did saying nobody was addicted, who wouldn't want to eliminate their pain, feel better, get their life back? So everyone started taking opioids for all their pain needs. 2010, the prescription of opioids was pretty much at its highest, with everyone thinking it's okay. But in 2016, 64,000 people died from an opioid overdose. Not only that, but 1.6 million people ended up having an opioid use disorder, with 745,000 people using heroin. Deaths attributed to opioid use skyrocketed. People found themselves reeling from addiction and using it as a necessity to eliminate pain. Studies have now come out showing the extreme addiction that opioids and heroin can do. And since then, it has been very toned down on what can be prescribed. 1 in 7 people taking opioids for just 8 weeks will still be taking them a year later. And if you take those for 31 days, your chances skyrocket to 30%. Just after 2016, COVID happened too, and we saw a massive increase in opioid use with the COVID-19 pandemic, indicating more addiction, more reliance, and just a blanket over pain instead of actually curing it. It was a huge step back for professionals who relied on research that was not done correctly. And because of that, millions of people suffered from it. So what does this tell us? One, it tells us that our research needs to be done correctly. But two, it shows us as physical therapists that taking a manual approach to physical therapy, which we'll talk about in later modules, has shown to be effective and doesn't hold the risk for complications like opioid use does. If we're truly focused on the patient's long-term health and not just masking the symptoms, addictive medications are only going to hurt us more than help us. That's it for opioid use. Swipe down the next one, going into the science of pain, how it works. It's a good one.